is made possible in part by Allstate and the Searle Funds at the Chicago Community Trust.
Good evening y bienvenidos to Chicago Tonight Latino Voices. I'm Alex Hernandez of Univision Chicago Primera Hora. We share every weekday morning at 5 and 6. Thank you for sharing part of your weekend with us. On the show tonight, in March 2021, the city was sent reeling when Chicago police officers shot and killed Adam Toledo and Anthony Alvarez just a few days apart. We'll take a look at where the relationship between law enforcement and Latino communities stands a year later. A new Medicaid expansion offers healthcare benefits for immigrant adults over 55 years old. A state plan offers resources to stop deaths from opioid overdose. We'll talk with local recovery workers about how the pandemic has affected substance abuse and overdoses.
Latin sounds, Latin vintage sounds that trigger our memories, trigger our childhood.
And a little village business where you can get a haircut with a side of vintage vibes. First off tonight, 1 year ago this week, 2 young Latinos were shot and killed by Chicago police officers. But who exactly was to blame for the deaths of 13-year-old Adam Toledo and 22-year-old Anthony Alvarez still divides Chicago's Latino communities. And in neighborhoods where violent crime is all too common, opinions on how police should operate in their communities are also far from united. Joining us now with more are Little Village Community Council lead organizer, Graciela Garcia, Waldemar Cruz, retired Cicero police sergeant and president of the Puerto Rican Police Association, and youth documenter and Pilsen resident, William Guerrero. I want to thank you, all of you, for joining us today. And I want to start with you, William. What was your response to the state's attorney's office declining to press charges against the police officers who shot Adam Toledo and Anthony Alvarez?
Well, first and foremost, thank you guys for, bringing the platform to us. And, I'll go straight to the point, right? It's very disappointing. It's disappointing, right? We just saw a human being kill another human being. There's no accountability whatsoever being holded to these officers that shot and killed these 2 young people, right? So it's frustrating. It's very frustrating.
Graciela, earlier this year also, 8-year-old Melissa Ortega was shot and killed in Little Village by a teenage gang member targeting rival gang members. And there have been more shootings since then. How much responsibility do the community members themselves bear for this continued violence?
Well, I wouldn't say the community members have responsibility. I would say, our community has generational trauma that our youth is experiencing right now. And a large part of these violent acts that are being committed are because there is no resources for mental health for these individuals to heal. In part, the reason, or some of the reason that they're doing it is because, the reality of this pain that's generational that exists in our community. And then we live in a community that basically everyone suffers from PTSD. So they don't have the resources, they don't have the knowledge to heal, and they express themselves in these violent acts of crime. In part, it's cathartic to them because it feels better than what their reality is. So there is no resources such as mental health so that we can say, okay, then now what is the reason, that the community does hold some accountability? But even when we try to hold people responsible or that accountability, it's, a hope or something that beyond our reach that we're unable to obtain.
Okay. And on this next question, I actually want to hear from all 3 of you about CPD, if they did the right thing or not in revising their food pursuit. So I want to start with you, William.
Well, there's a lot of things that could have happened, right? In the case of Adam, he could have been tackled down, and if there was a need to use a gun, he would have been shot anywhere else, right? Police officers are trained, to shoot anywhere else, right? But the fact that he was shot in the chest, right? And it's, again, it's just frustrating, right? why the need of gun, right? It could have been tased, any other methods that would have had Adam still alive today. But no, that hasn't happened, right? And you know, I don't think they did the right thing, right?
Waldemar, the same question.
It went through this process. We keep answering this question. We have 6 decades in some of these communities, especially Latino communities, because I grew up in Humboldt Park, Logan Square, when it's predominantly Latino. We had a lot of gangs, a lot of violence. And the problem is the 6 decades of gangs who are grooming young people. It's been generation after generation grooming young people to join gangs. Is it a tragedy? Yes, that we lost the life of a young person. Is it a tragedy that we don't have mental health clinics open? Absolutely. But we cannot continue to blame the police. In the last whole year, the 2021 to 2022, there was 276 shooting victims under the age of 16. 43 were under the age of 13. And we don't hear the public complaining about that. We don't hear the community activists saying that's an issue. It's always an issue when the police are called out to protect a society, to protect the public, and they have to make split-second decisions to save their lives or others.
Graciela, what do you make of the food pursuit?
Well, I want to comment on something.
Mm-hmm.
Our organization most definitely does not blame the police. In fact, we're not looking to blame anyone. We're looking to have solutions, because that's what should be part of the conversation. There's nothing going to be fixed when, you know, they start saying, well, it's the parents' fault, it's the police's fault. Let's throw in the teachers there too, right? Nothing is going to be resolved with that. The real conversation should be held is accountability from everyone, right? So the police put in part these policies, right? And even when these policies are in place, police officers do not follow those policies. We have paid millions of dollars for those infractions that they do not follow. Some of them have even paid with their life that they have not. That woman police officer, I cannot remember her name, but she didn't follow the policy that was put forward.
Graciela, what should the police do then with foot pursuits?
Well, with foot pursuits, you know, it's a very difficult thing to comment on. But in police pursuits, if the safety of others is not going to be compromised, then obviously to stop that crime in action. But there is many times the city of Chicago just paid out on a pursuit that they were told to stand down from, where that child was killed, and there we go, paying out more money for something that they've done.
I want to move on because there's obviously other questions. But what other factors do you see contributing to violence that police cannot address?
What do I see that are factors? Obviously, the same thing as always, you know, lack of resources, lack of communication with the community, reaching out to individuals that are in need. Organizations like myself that operate on a $7,000 a year budget that are limited because of the funding that's not available to us. That's part of what we see here. Again, it's all about the resources that are lacking in our community, and it shouldn't be lacking, especially not Little Village, when you know the revenue we produce is always being compared to Michigan Avenue, but we do not have those same resources as the other communities do.
Listen to this, Waldemar. Chicago has more police per capita than almost any other city in America, but violence rates have been high for years. We know that. How should communities determine whether police are doing a good job?
Well, that's a difficult question right now, because we have the police held at such a high standard, which we understand. That's what I took the job. I understood that we're held at a higher standard, but at the same time, everything is pointed at us. We handle so many duties while we're on the job. We're supposed to be social workers, psychologists, teachers, handle marriage counseling, a lot of domestic issues, a lot of alcohol and drug issues. Then we add the gangs, the violence, the issues that happen at local schools. That's a lot of wear and tear and a lot of pressure to put on police officers. Then we're undermanned. I know everybody says we have the highest police presence per capita, but under the city budget, we went from 13,000 police officers. We're close to 10,500 and hundreds retiring every month. Instead of us producing a system where we diversify our police department, where we take communities like Little Village and Humboldt Park, and we partner up, we would love to have our communities as members of the police department.
Unfortunately, our time is up. I know we could spend here a whole hour debating about this, talking about this. I want to thank all of you for joining us today. Graciela Garcia, Waldemar Cruz, and William Guerrero. Thank you so much.
Thank you.
In December 2020, Illinois expanded Medicaid to provide health coverage to immigrant adults age 65 and older. Now, another expansion will offer health care benefits to low-income immigrants age 55 to 64 starting in May. Dr. Yolanda Escalana, medical director of Cook County Health's Arlington Heights Clinic, says the expansion was necessary to help protect the health of a very vulnerable population.
It allows us to provide more coverage for our patients that our system can't provide for them. Like, for example, in our system, our patients can receive prescriptions, healthcare, primary care, specialty care. But if they need other things outside of that, for example, durable medical equipment like oxygen at home or supplies if they have wounds or problems with incontinence, these are the services they can receive with this program. These are older patients who come from other countries, who are dependent on their children. And a lot of them are afraid that they can't afford healthcare, nor do they want to be a burden to their children. So they will stay home and will ignore their care. A lot of our patients, my patients, will come in with end-stage health conditions, advanced problems. And if they just had the healthcare, that coverage, they wouldn't be afraid to come in sooner. So that's why, as a primary care provider who believes in prevention, this really helps me and helps my patients to be comfortable to seek that care.
There are some limitations on the program. Home health care, rehabilitation care, and long-term nursing are not covered under this program. Those interested in applying can find more information on our website or can apply in person at any Cook County Health location. Up next, Brandis Friedman on an effort to stop overdose-related deaths. Stay with us.
Governor J.B. Pritzker recently outlined a plan aimed at stemming the tide of deaths due to opioid overdoses in Illinois. The Illinois Overdose Action Plan offers new and expanded resources to help treat substance abuse and addiction, including a mobile van with medication-assisted recovery, overdose education and treatment via naloxone, that's an opioid overdose reversal medication, and a partnership to provide mental health and recovery services to communities most affected by opioid deaths. This as Chicago communities Austin, Humboldt Park, and North Lawndale reported the highest number of opioid overdose deaths ever in 2020. Joining us now with more on this are Laura Coover, Associate Vice President of Child, Youth, and Family Services at Catholic Charities, and Evelyn Delgado, Manager of the Medication Assisted Treatment Program at Esperanza Health Centers. Thanks to you both for joining us. Evelyn, let's start with you first, please. Have you seen an increase in the opioid use since the pandemic began?
Yes, I believe so. We've definitely had an increase in our referrals to our program. There are a lot of factors contributing to that, but we've definitely seen an increase in patients seeking treatment.
What are some of those factors that you just mentioned?
So a couple of factors contributing to the rise in referrals are access to resources. During the pandemic, a lot of the resources were not available to many patients. A lot of places had wait lists or were not accepting new patients. A lot of patients or clients were seeking other forms of support because their current support systems were no longer available. Because of the quarantine and pandemic, everything that was going on, they could no longer go to meetings or go to groups or meet with their sponsors or their support network. And a lot of people have been more accepting of the different kind of treatments that there are. So I think those are a couple of the factors that have contributed to the rise in referrals.
And Laura Coover, so this month, Chicago's health department announced that it would stock doses of naloxone in 14 public libraries. How do initiatives like that help to stop deaths?
Getting the naloxone into the hands of the people that need it, that will be there in a situation in which someone overdoses, is the way that we can save lives. So having it be so available in places that community members go to and so easily accessible, no questions asked, is getting it in the hands of the people that need it the most.
Evelyn, talk a little bit about how Esperanza approaches treatment for substance abuse.
So we have a very harm reduction approach to substance use. We accept patients as they are. We allow the patients to identify what recovery means for them and identify their recovery goals. And a couple of ways that we do assist their recovery goals are through medication, which could be buprenorphine or a number of other medications. And we also provide Narcan, which is one of the medications, one of the versions of naloxone, free of charge to patients who are underinsured or uninsured. And any patient that comes into our program, whether it be for opioid use disorder or any other use disorder, or substance use disorder, will also receive education on how to use Narcan, a prescription for it. And again, if they cannot afford it, we will provide it to them free of charge. And
of course, when you say harm reduction, you mean basically reducing the harm, not telling patients or clients that you have to give up the drug entirely, but can we reduce the amount that you're using and introduce some of those other medication-assisted recovery tools?
Yes, definitely. We definitely have a any positive change kind of mentality. So if it's using less, if it's having Narcan available at all times, if it's being able to get or keep a job, whatever their goals are that we can support, that's what we will work with the patient with.
Laura, how much does fentanyl, how much is that factored into the number of overdose deaths that we've been seeing?
I think that it's factoring in a lot. With fentanyl, it's just so potent that just a little bit can have some real lethal, deadly effects. And for clients that think that they're using heroin and it's really fentanyl or it has fentanyl in it, they're not even aware of what they're putting in their body, and it's really has some dire consequences.
Laura, what are some of the services that Catholic Charity offers to help people with addiction?
So we offer a program that serves pregnant and postpartum women that is funded by DHS Super Division that works with pregnant and postpartum women who have substance use disorders. So we do home visiting and doula services, which is really a cool way to service the women coming to us for help. And then we also have traditional outpatient substance use services that are available.
Evelyn, what are some of the barriers to treatment that the members of the Latino community specifically might experience?
There is definitely a number of barriers that patients would face, especially in the Latinx community. A couple of them being access to resources. Again, there are not that many resources available in Latino or Latina communities. Another one could be childcare. Many of our patients do have children, so accessing childcare so they can come to appointments or to look for resources is a huge barrier. Employment is another one. Many of our patients struggle with employment either due to immigration status or not having access to, let's say, computers or anything to apply for jobs. And also, access to insurance. Some of our patients aren't uninsured or underinsured, and that can prevent or hinder them from looking for resources because they may believe that they cannot afford them.
And before we let you all go, Laura, what more do you think the Pritzker administration could do to support organizations like yours, and especially people who are facing addiction?
So I think always it's increased funding. The more funding we have, the more services that we can provide, the more innovative we can be with the services that we provide and get them in the most, easily accessible locations so that the clients who need the services can get the services that they so desperately need. I hate that it always comes down to money, but it always comes down to money.
Of course, a very difficult job as well. I want to thank you both for joining us, Evelyn Delgado and Laura Coover, for joining us.
Thank you.
Thank you.
And we're back with more Chicago Tonight Latino Voices right after this.
Nearly 700,000 of Chicago's residents claim Mexican heritage. And over the years, Mexican culture, from food to music, has become woven into the city's tapestry. A new business in Little Village explores where Midwestern meets Mexican by combining haircuts with deep cuts. Chicago Tonight's Erica Gunderson recently brought us this story. Here's another look.
The sound of a neighborhood barbershop, friendly chatter, clippers buzzing, and scissors snapping is unmistakable.
Did you get that on Amazon? I did.
But folks getting a trim at Del Pueblo Barbers and Records are also hearing the soundtrack of a Midwestern Mexican childhood, from vintage rancheras to Chicago house.
I remember there was a bar on Racine when I was a little boy, and a lot of people from Texas are in Chicago. So the big Texas sound of like Little Joe and the Family and Flaco Jimenez and things that were like what they call cantina music. I just remember getting my aunt to tell me, go tell your uncles that dinner is ready. And I already knew where to go get them because they were all sitting down at the bar. And I remember going up to a bar stool and like, hey, dice mi tía que está lista la comida.
For barber and co-owner Jonathan Guzman, those sounds were just part of growing up Chicano in Chicago.
There's a Chicago Midwestern Mexican which stands alone and we're one of a kind. We maintain our identity, but when we speak English, we sound like we're from the West Side. When we dress, we got the Sox hat. We're very Chicago, very American, very urban.
Jonathan says his skill in the tonsorial arts also stems from his childhood.
I started cutting hair out of necessity. We didn't have the money to go to a shop every 2 weeks and get a haircut. So my mom had a pair of clippers and had shears, and she cut my dad's hair, she cut my brother's hair, and she would cut my hair, but she would cut my hair in a way I didn't want it. So I learned to cut my own hair. And then my friends in the neighborhood who were also in the same situation decided that I was gonna be the guy who would cut their hair.
When the opportunity arose to open a shop in the heart of Little Village in July 2020, Jonathan and his business partner Leo Guzman, no relation, jumped at the chance to create a place where the Midwestern Mexican would feel right at home.
We do things a little differently that I've noticed here than other cities. We're very proud of who we are in Chicago, and I think that's what community is all about, right? Is making other people feel like you're one of them, and I definitely feel that here. I might not look 110% Mexican. They call me Widow for a reason, but it definitely, it feels like home.
All around the shop are the sounds and signifiers of Chicago Chicanos, from the locally made art and merchandise for sale to the vinyl records they sell and play on an in-store turntable. Leo Guzman, who also DJs, manages the music collection.
Our collection basically is made up of Latin American music. We try to focus on las norteñas, mariachi, rancheras, tropical music, from cumbias to salsas. We have music from Tigres del Norte, or Broncos de Reynosa, where, they mention Chicago, and they mention certain streets, they mention Little Village, and that's really what I like. I like to, tell a story through music. A lot of the music that we try to play here is also new. We try to promote new bands.
Everything is done here. Everything is done locally. And from the beginning to the end, except probably for the actual making of the t-shirts, which are probably made in China. I'm sorry. Everything else is done here, and it's providing income for everybody down the line.
Jonathan and Leo say they're hoping Del Pueblo can be a place for Chicagoans, Chicano or not, to celebrate the unique blend of cultures that is Little Village.
I see the little kids who are looking for an identity, who are looking for a space, who are looking for a place to identify. And if you offer them some turntables, they can learn about Chicago house music or freestyle music. They can learn about how Chicago and Little Village and Pilsen influenced the world sound.
It's a safe space where you can come by and socialize and get creative, ultimately. You know, I encourage everybody to come by, share the music with us too, because that's ultimately what this space is for, is to keep that culture flowing, you know, and keep the next generation interested.
For Chicago Tonight, Latino Voices, this is Erica Gunderson.
Well, you can find more on Del Pueblo Barbers and records on our website as well. Well, that's going to be our show for this weekend. If you're watching us on Saturday night, know that you can also catch Latino Voices and Black Voices on Sundays beginning at 10 p.m. And don't forget also to tune in to Primera Hora on Univision Chicago every weekday morning. I'll be waiting for you, and I'll be back here in the host chair next week on Latino Voices. We'll leave you tonight with images from the Frida Kahlo Her Photos exhibit, now open at the National Museum of Mexican Art. The images are courtesy of a Bank of Mexico fiduciary in the Diego Rivera and Frida Kahlo Museum Trust. Now, for all of us here at Chicago Tonight Latino Voices, I'm Alex Hernandez. Thank you for sharing part of your weekend with us. Buenas noches.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a personal injury law firm dedicated to preserving the dignity and rights of all individuals.